The wife of the Vice President, Mrs. Matilda Amissah-Arthur, has added her voice to the call for support for health facilities. Experts say if properly resourced, health workers can deliver quality service. Mrs. Amissah-Arthur was speaking on a visit to the pediatric block of the Sogakope District Hospital. Theodora Medeto reports.
The sod was cut for the construction of the South Tongue District Hospital at Sogakope by former President Jerry John Rawlings in 1998 and opened by the late former Vice President Alhaji Aliyu Mahama in 2001. 15 years on, the facility continues to be commended for quality health care to patients. Mrs. Amissah-Arthur's visit to the hospital was to first acquaint herself with the challenges and to visit the pediatric block of the hospital. In spite of its pluses, the facility is not without challenges. The medical superintendent of the hospital, Dr. Ernest Abude, appealed to the government to speed up the National Health Insurance Authority claims payment and provide staff accommodation and transportation for the smooth running of the facility. Both the South Tongue District Director of Health, Madam Helen Sapong Akosa, and the Volta Regional Director of Health Services, Dr. Joseph Nweti, said CHIPS compounds were important in managing maternal and infant mortality rate, which have been on the increase in the district.
We have planned from our own resources to build what we call mother-baby units, which will be attached to the maternity unit, so that children who are born distressed will be taken care of with the support of their mothers. This we are going to do from our own resources. We realize that if we have to depend on high-tech, that is, get incubators and whatever, it will take a very long time, and our children will continue to die. But we know with a low-tech, we can be able to do something. So this is the initiative as a region we have taken, and within the next 1 or 2 months, facilities should begin to put up structures close to the maternity unit, and then we use the mother-baby, the kangaroo mother care to be able to take care of these children.
Mrs. Amissah-Arthur offered some advice on how the hospital can effectively manage child mortality.
Most of the factors that cause the death of the babies really are avoidable. A lot of them are avoidable. So I was very happy when she talked about the things that they are doing here. And may I add that if you haven't looked at it, use mobile technology. Even in America and things, they use mobile technology. In East Africa, all the pregnant women are encouraged to link onto the hospitals so that the midwife can call you and using your data there, tell you when your next antenatal is due and tell you when you have to come. And then you also can call when you have problems and things. I think you should explore that avenue also, because not everybody has a mobile phone.
The personal commitment of the wife of the Vice President is to ensure in her own small way that healthcare delivery, especially to children in the country, is upscaled. Since last year, she has visited many pediatric wards around the country. Her visit to the pediatric block of the Sogakope District Hospital was to put a smile on the faces of the children on admission. The children's block, which houses 3 wards, medical, surgical and the infectious, on the average, mostly handle malaria cases. Mrs. Amissah-Arthur was hopeful that with assistance from the government and other benevolent organizations, the desired result of health care delivery would be achieved in the region, especially when success stories are shared and replicated at other health facilities in the region. Theodora Medeto, GBC 24, Sogakope.